I am one of the admins for this conference, and I am an RN with well over a decade to go. Well over a decade of experience in ER trauma and critical care. I'm an avid reader. I'm a fantasy author, and I'm currently working on a fantasy romance. Most of my work is YA fantasy. One of the things that I hear all the time is, why should you care if your character's injuries are believable? It's fiction, right? Well, kind of. Suspension of disbelief only goes so far. And unless you have some kind of magical healing for your characters, there comes a point where it just isn't believable and people will put the book down and walk away. I once fairly recently read a book where the main character ran 3 miles with 8 broken ribs. That's not physically possible. I've cracked ribs. I tried to run a mile with 2 cracked ribs. There's no way. You can't do it. You can't breathe. And if your readers can't believe what's happening to your characters, you will lose their trust. And if you lose their trust, they will put the book down and probably not pick up anything else that you've written. So I'm going to kind of progress through from the head down as we talk about different injuries for characters. Point 1, there is no such thing as a harmless knockout. If your character is hit hard enough in the head to knock them out, they have a concussion. They're going to have symptoms after that for weeks or sometimes months. Dizziness, brain fog, struggling to come up with common words, headaches, sensitivity to light, and some of that, especially the headaches and sensitivity, can last years. So if your character gets knocked out and then just jumps right back into the fight, they're going to struggle some. And if you don't have that in there, it can be hard to believe. Hollywood lies a lot, and the things that they do in the movies don't translate well to our fiction books. Chokeholds are another one that Hollywood loves. They're effective when used to kill, but they're not fast. It can take 3 to 5 minutes for a person to fall unconscious from a chokehold, and even longer than that to actually die. That's a really long time to struggle. And it leaves obvious marks that police and medics would be able to identify immediately. Like it's really easy to look at them and say they were choked. It's not a silent way to kill somebody. It is not an effective way to just knock somebody out for a kidnapping. That was another book that I recently put down, was that the character was being kidnapped and they were knocked out with a chokehold in seconds. And I was like, yeah, that's not how the body works. Anything in the neck can be really iffy. A broken neck is an effective way to kill somebody, yes, but it's not easy to do. There's a lot of structures in there that support it. And then as we go on through the body, cracked broken ribs hurt. And they take a long time to heal because it's not like another bone that you can splint and protect and not move. If you break your arm, it's probably going to heal in 6 to 8 weeks, and you'll be pretty much back to normal. If you break a rib, it can take months because you use it for breathing, and you can't not use it. If they're not displaced, then there's really nothing we do for them besides just keep an eye on it and try to be gentle. Displaced or shattered ribs can make breathing difficult or impossible, and can puncture things in the chest. They can puncture the sac around the lung. They can puncture the lung itself. You can get a buildup of fluid or air or blood in the chest, and you cannot fight through that. It's not physically possible. You can't breathe. Your heart can't beat. You can't continue. Um, It is lethal without modern medical intervention or magical healing if you're in a fantasy realm, and it needs to be treated immediately. Um, that comes back to the character that was running 3 miles with 8 broken ribs. You wouldn't be able to crawl half a mile, let alone run. Gunshots. I get a lot of questions about gunshots. Everybody wants the dramatic, oh my God, he's been shot. But the way that a bullet moves through the body is not pretty. And I really would recommend, if you want to write gunshot wounds, to spend a little bit of time looking at pictures of entry and exit wounds on the internet. Because the type of damage that's done varies a lot by what kind of weapon you're using. But in general, if you want your character dead, a gunshot wound anywhere between the collarbones and the pelvis will do the trick. There's really not any space in there that's not used. Everything is packed in really tightly. There's no empty areas for a bullet to pass through harmlessly. Again, Hollywood lies. I've seen it in movies, and I'm like, yeah, that's not how that works at all. And even if you finally somehow manage to thread it in between structures, the pressure wave that it creates would damage those structures. Without modern medical intervention or magical healing, a gunshot between the collarbones and the pelvis is a dead person. And if it's in the lower part, in the abdomen and the belly, that could sometimes be a very slow, painful death from infection, before modern surgical techniques and antibiotics, because it spills bowel contents, and that's just not something you want anywhere else. Harmless gunshot wound locations are your extremities, your arms, your legs. And harmless is used very loosely there. Gunshot wounds get infected quickly, and they do a lot of damage to bone structures. Beware the shoulders. I see a lot of people trying to put a harmless gunshot wound in the shoulder. Depending on where you mean in the shoulder, like over here in the meaty part of the outer arm, you could probably get away with that. If you start moving in towards the chest at all, there's a lot of really critical structures in there. Up in here, you've got lung, you've got nerve bundles in there, you've got some very large blood vessels in there. If it's anything other than the meaty part of the outer arm, you're probably not going to have a believable injury, unless you want your person dead. If you want them dead, then that's just fine. Everyone's favorite hand wavy, yeah, but it's adrenaline. He's hyped up on adrenaline, right? Wrong. That is not how adrenaline works. Adrenaline will give you extra strength to do a little bit more than you would normally be able to do. But you have to have a physically intact body for that to work. More believable ways that adrenaline works is it gives you the energy and the strength to crawl out of a fight and find a nice little cave to curl up and die in. It will give people the energy to, like, you hear a lot of stories about people lifting cars and things like that, and with an intact body, those things do happen. How do arrow wounds compare to gunshot wounds? Arrow wounds are almost more like a stab wound, because it's a very narrow um, wound. The um, oh, sorry, I'm missing a couple of these stories. Yes, I was talking about getting knocked out by being hit in the head. Being hit in the head is never harmless, or being knocked out by being hit in the head is never harmless. And the old chloroform on a rag to knock someone out, that takes 2 to 3 minutes to take effect. And as soon as it's away from your face, they start to wake up. And there's a very, very fine line between an anesthetic dose of chloroform that will knock somebody out and a lethal dose that will just kill them. That's why we don't use it medically at all, ever, because it's not effective. Am I missing any other questions? All right. I don't know why my computer wasn't updating those. I'm sorry about that. Where was I? Adrenaline. We were talking about adrenaline. Adrenaline is not a magical substance that will give you superhuman strength for a long period of time after an injury. It will clarify your thoughts in that moment so that you can see what needs to happen and act quickly to do it. It will give you a slight increase in speed and strength, as long as your body is still intact. If your legs are broken, you're not running a mile. If your ribs are broken, you're not running anywhere. Your body has to be intact for that to work. The other thing that it does is it will sometimes create, everybody hears fight or flight. There's a third option, fight or flight or freeze. It's almost like the deer in the headlights reaction to a threat. And it is a completely normal response for somebody who has never been in a fight, never been in combat, never been in a battle, to freeze. And can't physically make yourself move. And that is a normal response to adrenaline as well. Starvation is another one that I see misused relatively frequently in fiction. Starvation takes a while to happen. I recently put down a series that I had been reading because the character was held captive and fed one meal a day for 3 weeks. And then he was rescued, and he required months of physical rehabilitation and food to get back to where he was. But it takes longer than that. You can survive on one meal a day for a long time. A lot of people do it on purpose. They call it intermittent fasting, and it's a really popular weight loss method. And it's not starvation. We've all seen the pictures of rail-thin survivors of various disasters being rescued. That takes months. It takes months and months to get to that point. It doesn't happen in a couple of weeks. And they're not being fed a whole meal every day. They're getting what little crumbs they can scrounge together. And refeeding after starvation is not sitting them down at a banquet table and letting them go to town, because they will develop pancreatitis and they will die from that. Refeeding takes a little while to build the body up to be able to tolerate food again. And stab wounds are another one that you can get away with more on stab wounds than you can with gunshot wounds by a lot. I've seen stab wounds where it's in areas that really should not be harmless, but they somehow manage to miss everything. And I've seen that personally, so I know that can happen. If you want a scary but harmless injury, a stab wound is a more believable way to do that. For an amputee wound, how long is pressure applied? If it's amputated, pressure alone is not enough. You've got to put a tourniquet on, because whether it's arms or legs, there are big arteries in there that take a lot of pressure to stop it. Some of our newer medical devices that we have for amputation injuries are really interesting. They almost look like a tampon that is saturated with clotting agent, and you stick it into the artery. And then you just have to hold that for a minute, and it'll block that off. Otherwise, and those are brand new, less than 5 years. Without those, a tourniquet is the only way to stop you from bleeding out from a amputation. And yes, one meal a day can absolutely give you a lot of energy to get through and keep you from starving to death. Yes, people can pop a dislocated shoulder in by slamming it against things, especially if it has been dislocated before. When you do it the first time, it's much harder to pop it back in. But if you have a shoulder, some people have a trick shoulder that just pops out periodically. And yes, they can put it back in by pushing it against something, by slamming it against something, or by having a friend press on it just right. That is a real thing. That was one of my favorite things to do in the ER was to reset shoulders. Because it was something that I could do in triage, and then we send them to x-ray and make sure that everything's as it should be, and then they're on their way. Well, that's not fun. Yeah, we don't want joints popping out just for by accident, but it is a thing that a lot of people experience. It's not uncommon, especially a joint that has been dislocated before. Those ligaments are looser than they should be, and they will pop back out. One of our patients used to come in fairly frequently because her shoulder would pop out while she was sleeping, and she'd wake up in the morning and it was dislocated. And she finally had surgery to fix those ligaments. Barbed arrows. I've never seen an arrow wound from a barbed arrow. But theoretically, the only way to get it out would be to push it through. Because obviously if you pull, that barb catches and you create more damage. Another interesting point on the arrows is if you're using anything more than a kid's bow, the arrow is going to pass all the way through the body. There's enough force in that it doesn't really stick into the body like it does in Hollywood. It goes all the way through. And I've seen a couple of those injuries, and I've never seen one where the arrow was stuck in the body. It always just goes straight through. Does it hurt to pop back in? Yes. Yes, that hurts. And yes, it would need to be immobilized because there's a lot of damage that happens when you pop a shoulder out. How hard is it to dismember someone by sheer force? It takes a lot of pressure, a lot of pressure. My daughter has studied a lot of the medieval devices, and it took hours upon hours upon hours for the body to actually start to come apart, even in the medieval torture racks that they had. Yes, a gunshot wound to an arm or leg can create that pressure, that sonic pressure wave that can damage other organs. Also, bullets ricochet. You may have been shot in the knee, and then the bullet ricocheted up into the pelvis and created havoc in there. I've seen that. So just because you're shot in a leg doesn't mean the bullet stays there, and it doesn't mean that that's the only damage that's done. Injuries pertaining to falls. There's a lot of questions about that. How high can someone fall and still survive? It depends on what they're falling off of, what the wind is. Is there a wind that's slowing them down on their way down? And what are they falling onto? People can live going into water from a higher height than they can falling onto concrete. But in general, the highest I've seen survive without devastating injury was second floor. Falling from the second floor roof onto the ground, and that was into grass. But even then, he had some bruised kidneys and a couple broken bones, and was not feeling great. He didn't get up and continue doing the work that he was doing. But it depends a lot on what you fall off of and what you fall into. Being drawn and quartered. This is not something that I've ever seen and not something that I know a lot about. I just know that according to historical records, unless they were using knives to speed the process, it took a long time to pull the body apart. I would think that large animals would be able to do the job faster than like a rack would, but again, this is not my expertise, and I don't know exactly. That would be an interesting rabbit hole to fall down. I'm sure that there have been studies done on things like that, because it is something that was done in medieval days. So there may be more information out there that I don't have. Any other questions? This has been a great discussion. You guys have some really good questions. How hard is it to cut the jugular? It's not hard at all. It's really superficial right here. And if that is cut, yes, you will bleed out very quickly. And just below the jugular and to the inside is the carotid artery. And if you cut that, then you will bleed out in about 30 seconds. How hard would you have to punch someone in the head to kill them? This is something that actually happens more often than you would think. People get into a fight, and if you hit just right in just the right place, the bones in the face can be very fragile. And if you hit just right, especially in the cheek and around the eye, if you break those bones, they can shoot up into the brain and kill somebody fairly easily. It's more about where you hit and how than about how hard. Speak about amnesia. That's a fun plot device because we don't know a lot about it. It is a thing that happens, but we don't know a lot about why and what makes people get their memory back. That's one of those things that really is fun to play with from a plot perspective, because we don't have a lot of answers from a medical perspective. Could it be something that's a lot of swelling, and as that swelling goes down, you feel better and get your memories back? Perhaps. But the brain is one of the parts of the body that is always regenerating itself. So injuries, really severe injuries, won't necessarily regenerate all the way, but you do see people who have had strokes that are able to regain a lot of their function. because it is regenerating. And I think amnesia and the recovery of memories is part of that regeneration. How would I handle a client that describes injuries inaccurately in their stories but won't change it because they claim it's fiction? I'm not an editor. I do work as a consultant. I'm one of the experts in the Facebook group Trauma Fiction, where we can answer questions about people's individual stories. But I'm not an editor, so I don't have paid clients that I'm working with on this. I just give everybody the warning that in your mind it may be fine, but you're always trying to walk a line to get your readers to trust you. If your readers don't trust you, then they're not going to necessarily bother to finish reading your story because they don't trust that you've done the work to make it believable. One of my stories is mermaids and dragons underwater. And in order to get people to buy into the idea that there's mermaids and dragons and magic underwater, I have to get the actual real life physics of how the water works right. So people will trust me because I've done this work and I can get them to believe more. Burns are so the worst pain of burns is your first and second degree burns. Once you get into third degree and fourth degree burns, a lot of times there is no pain initially because yes, those nerve endings have been destroyed. And without the ability to send the signal, your body doesn't realize that there is pain. As those nerve endings regrow in the healing process, it is excruciatingly painful. One of the most devastating places to ever go in a hospital is the burn unit. I would not wish that on anybody. It's horrible. Can burns be bad enough to kill someone? Yes. How bad would they have to be in general? If you have third degree burns over more than about 20% of your body, you're in some real danger of not surviving that. We in trauma, we work in the rule of nines. And so it's 9%. If you have 9%, you are severe enough to go to the burn center. 18%, you're probably not going to survive it if it's third degree burns and fourth degree burns. But a lot of that has to do with fluid shifting and infection, because fluid moves around a lot in the body in response to burns. How bad can someone endure a burn and still push through enough to fight or flee? This is one of those that we actually have some references on because people have been running into and out of burning buildings for as long as people have had buildings. And that's one of the places where adrenaline can believably step in as long as the bone structure is still there. Once you get about 30 minutes past the initial injury, then you start getting that fluid shift and the actual function of the body stops. You just can't keep pushing through after that. But people have pushed through some pretty severe burns to get out of a building before they collapse. One of my characters gets kicked in the head and is knocked out. Is it believable? Yes. Is it possible? Yes. Are they jumping up after that and carrying on as if nothing happened? Probably not. They're going to be dizzy. They may be nauseated. They are going to have headaches. They're going to have some brain fog going weeks out. It's not going to be People get knocked out all the time. They just don't jump up and right back into the fight. Yes, infection and fluid shift are the two biggest killers when it comes to burns. Because the body tries to hurry lymph into the burned areas. And so you end up with severe swelling around the injury, but then you don't have enough fluid left in the vasculature. And so you end up with very low blood pressure as if you've bled out because all of the fluid is rushing to the burned areas. And so a big part of burn management from a nurse perspective is watching that fluid shift and making sure that we're replacing fluids during that initial shift and taking fluids off when it shifts back. And infection is always a big risk when you have large areas of the skin that are broken. Other ways it can cause an unconsciousness besides head injuries. People can and do pass out from pain, but usually that's a severe trauma. Dehydration is a big one. People pass out all the time from dehydration. You don't get enough fluids, and then you stand up and your blood pressure bottoms out and you fall out. Beyond that, like I said, I'm one of the experts in the trauma fiction group. We talk a lot about different poisons and druggings and things like that, because it is more believable way to deliberately knock someone out and have them come back from it, is to drug them. Yeah, Hollywood makes up a lot of stuff. And a lot of it you struggle really to believe, but yes, getting knocked out can affect your ability to speak, can affect your ability to understand speech, and also the written word. Adding on to Monty's question of unconsciousness, how feasible is it to depict fainting due to emotional or psychological distress? It depends on the person. If you have somebody who's lived a very sheltered life, and they've never really had to deal with adversity, and then now all of a sudden their world is crashing in, they are more likely to be at their breaking point, and they may faint from psychological distress. If you have someone who has grown up on the streets and has had to struggle every day of their lives, they're much less likely to faint from just distress. It would have to be a much, much bigger shock for them. It just really depends on how much they've struggled in their life up to that point. Going back to chokeholds, if a person is choked out, are there brain issues like the blow to the head? Not usually, because even with being choked out, there's some blood flow still getting to the brain, which is why it takes so long. It is not physically possible to occlude all blood flow to the head unless you cut off the head. Because there are arteries and vessels that are further back that you just can't occlude. So usually once the pressure is released, they come to very quickly, which is, again, why it takes so long. And it's 3 to 5 minutes. Doesn't sound like a long time, but when you're struggling physically like that, it is a very long time. Do you know what the biological mechanism that causes fainting by emotional psychological distress? Yes, it is. It has to do with the vagal nerve. And we will say that somebody vagaled down, and with stimulation to that nerve, it drops the heart rate, it drops the blood pressure, and then you faint. That is what causes people to faint at the sight of blood. That is what causes people to faint when they're stuck by a needle. It is called a vasovagal syncope, where it's stimulation of that nerve. And people who are very, very prone to it, they will sometimes get a procedure done where they'll go in and cut that nerve in the thorax so that it doesn't create so many problems. Where am I here? How easy is it to cause spinal injuries with blows or pressures to the back? Again, it depends on the mechanism of injury. Or if you're hitting somebody with a pipe into their spine, yeah, you can create some pretty severe spinal injuries. If they're falling flat, it's less likely. If they're bending and twisting, then it's more likely. The spine is well supported with the muscles of the back. The highest risk for really severe spine injuries on very minor injury, mechanism of injury, are the women who wear corsets all the time, because they lose the musculature. And then if they're not wearing their corset and they bend over wrong, they can damage their spine. Deep tissue injury healing for people in falls takes how long? And it depends on the fall, and it depends on the injury. If we're talking about bruised kidneys, bruised liver, internal organ injury, that's going to take longer to heal than bruised or torn muscles and ligaments in the extremities. But in general, a few weeks is kind of the minimum. What does fainting look like? From an external perspective, if you're looking at someone who is getting ready to faint, they get very pale. They start sweating. They break out in sweats no matter what the temperature is. They may get a grayish cast to their skin as their blood pressure bottoms out, and then they start to go down. Depending on what caused the faint, a lot of times they start to come to almost as soon as they hit the ground, because then the body is level and the blood pressure stabilizes, and then they're able to come back up. What is the recovery process like for a coma patient? In a coma for 3 months, for someone who's been in a coma for 3 months, when they come to, they have no muscle strength left. Sitting up requires a lot of support, and they take months and months and months of rehab to be able to walk again, to be able to feed themselves again, because those muscles atrophy very quickly. What would the recovery really look like for somebody with that? It's a lot of frustration. For people who have been in a coma for even 3 weeks, the good analogy is, for every week that you are unable to move your own body, it will take you a month to get back what you lost. So if you're unconscious for 3 months, you're looking at probably a couple of years to get back to being able to function mostly normally, depending on what created the issue for the coma to be that long. How long do people stay unconscious for? One of the things that we use from a trauma perspective to determine how severe a head injury is how long they were out. Usually, most people are unconscious for less than 10 seconds, and then they're up. And if you are unconscious for more than 30 seconds, you are automatically being admitted to a neuro ICU, and we're going to watch your brain pressures, because the risk for swelling in the brain at that point is very high. And that's only 30 seconds. That's not I was knocked out for 10 minutes and then came back, and now I'm fine. 30 seconds and you're in a neuro ICU. How long do spinal injuries result in paralysis? Often, yes. It takes a very tiny damage to the spinal cord itself to create paralysis. Christopher Reeve, of course, was paralyzed from C4 down, so a neck injury. And his MRI, if you were to look at his MRI, you could put the tip of your pinky over one little spot and it would have looked completely normal. Like it was a very, very small injury. And he was paralyzed from the neck down for the rest of his life. It does not take much. The spinal cord is one of the few things in the body that cannot regenerate itself. And once it's damaged, it's damaged. If someone faints from shock, how long does it take them to wake up? Again, most of the time they're starting to wake up almost the instant they hit the ground. They may feel a little disoriented coming back up. They're not out long enough to dream during a faint. It's very, very quick. How common is maggot therapy and what kinds of wounds is it used for? Usually that's used more in the burn unit and very delicate physical plastic surgeries where they're worrying about scarring, and they use sterile maggots, which are that's one of the few things that will make me gag even after years of being a medical professional. Maggots in a wound are just disgusting, even if they're sterile and we put them there on purpose. It's not something that we use frequently because it freaks people out. Patients don't like it, nurses don't like it, doctors don't like it, nobody likes it. But it is effective sometimes for facial burns, some very delicate plastic surgeries where we're trying to minimize scarring. If a writer or editor needs to research an injury, what are a couple of places people can go? The Trauma Fiction Facebook group is an excellent resource because it is staffed by nurses and doctors and medics, and we're there to answer questions. Another place to look is the Mayo Clinic website. I am not a fan of WebMD. Most of what is on WebMD is absolute bullshit. And it is not generally helpful. But Mayo Clinic, if you have access to PubMed, a lot of those papers are a little harder to read, but that's a good resource. And then, like I said, the Trauma Fiction Facebook group is excellent because it's nurses and doctors and paramedics answering questions. If a human character is fainting, being made unconscious in a fantasy setting by magical means, what line would I need to tread to make the effects of the faint and recovery believable? Once you start using magic, you can almost do what you want to do because we don't really have a point of reference for that. If you want to magically hand wavy them unconscious for an hour and then slowly bring them back out of that, you can get away with that. Because it's magic and it's not something that we have in our real world medical. So once I would say that the longer they're out, the longer they're probably going to need to come to, unless you have a medical or a magical explanation for why they're able to just pop their eyes open and jump up and be okay. What else cannot regenerate itself besides the spinal cord? The spinal cord and the brainstem really are the only two things in the body that don't have any level of regeneration. If you damage those, they cannot come back. Oh, look, I'm out of time. I'm sorry. I'll take a couple more questions and then we'll wrap it up. Yes, I will link to the Facebook group in Discord. And yes, that is the correct group. Any others? I think we are out of time. Thank you all for a fantastic discussion. Have a great rest of your day. I'm going to hop off of here and see what's up next. I'll be around. Feel free to track me down and ask questions that you may have.